Good afternoon, friends. I'm Dr. Ajay Shah, bringing this another afternoon live. Let me give you a quick update on our page. We have now more than 100,000 followers from all over the world, and we are actually bringing you not just the original six pillars of healthy lifestyle, which includes eating, exercise, sleep, stress management, substance abuse, and relationship. We're also bringing you another different pillars now. And today, actually, we are bringing you one of the most important pillar when it comes down to health, and that's about health economics. Our today's guest is Dr. Chris Lowe, who actually is a MD PhD, a great coach with lots of financial health information, a TED speaker, an author, an entrepreneur. So, I'm very, very honored to have Dr. Lowe because we definitely want to learn more about healthcare economics, how we can fix our, expensive healthcare system in America. So let's welcome Dr. Lowe. Welcome, Dr. Lowe.
Hey, Dr. Shah, thanks for having me. I'm so glad we were able to make this happen and contribute and give value to your audience.
Yeah, thank you. So please tell us, where do you live and what type of work you do now?
Sure. I'm based in Texas, and my background is in orthopedic surgery. Right now, I transitioned back in 2016. I transitioned full time into becoming a entrepreneur. So now I own and run my own company, which encompasses running and managing my investments. I do a lot of consulting for hospitals and high net worth individuals. I do a lot of coaching. I'm preparing for my TEDx talk in October, and I've written 4 books, and now I also sit on the advisory board of a early stage digital health AI startup. So I do a lot of, I direct digital health strategy for that company.
Wow, that's very, very impressive. So I definitely want to know about your MD, PhD training and education. Please tell us about your MD, PhD. What field did you do it in, and how has it been useful so far?
So I went to Baylor College of Medicine for medical school. I matriculated in 2000, and I was part of the MD, PhD program. And they had a special partnership with Rice Department of Bioengineering. So I got my PhD in bioengineering and nanotechnology, and that's where all of the nanotechnology startup culture started. Was back in Rice with Dr. Smalley when he won the Nobel Prize for the discovery of the buckyball. From there, really, it's really helped me because the 7 years that I spent in the MD PhD program were the 7 best years of my post-college life. I was around fantastic, very smart individuals, very fantastic mentors. Like I said, I started my 2 companies while in medical school. So that was in real estate and stocks. And I was able to grow those 2 companies so that by the time I was my final year of medical school, when I was 29 years old, I was able to generate my own income. So I really didn't need a job. So I haven't needed a job since 29 years old. Postgraduate, I went to orthopedic surgery, but that wasn't really my passion. So, but I did learn a lot of number of skill sets as an MD PhD. One is just as a physician, hard work, dedication, perseverance. It's also added a lot to my brand and credibility. So I'm able to coach physicians. So physicians reach out to me quite a lot, about my story and how they too can achieve financial freedom and the pathways and the resources to do so. It's also given me a lot of credibility, when I go and speak. It gives me, a lot of brand and a lot of a good reputation. So I did learn, and it's also helped me a lot as an entrepreneur because the valuable lessons I learned while as an orthopedic surgeon, I use it right now to manage risk, and it's really helped me to thrive and survive as an entrepreneur in today's COVID environments.
Wow, that's impressive. Nanotechnology. I mean, MD, PhD. I mean, that's just a cutting edge, and everybody's talking about it. And I think for your young age to achieve that, that's very, very impressive. And then taking a different path to, I think, further expand into financial freedom, and with such a young age where you can do whatever your mind, your heart says. I mean, I wish all of us are intelligent, hardworking like you are. But you are a role model for many of, our son is 30-year-old, he's a lawyer, daughter is in medical school. So I think you definitely are a role model. So they will be watching this thing, once it's on YouTube. So that brings a kind of an important question, which has been a burning question for me, and also for many doctors, many people actually, that what is the current status of our US healthcare system? We spend what, 20% of our GDP, almost $3 trillion. And I think we need people like you who has a background in medicine, orthopedic surgery, obviously, and also has a lot of interest into finances, because doctors alone cannot do it. CEOs alone cannot do it. We need somebody who understands both. So please tell us, what is the status of our healthcare system, and what's wrong with it, and how can we fix it?
Uh, I'll give you my 2 cents. Really, I mean, that's the reason why it's such a mess, is because it's so complicated. But from just looking at it in terms of in terms of uh, in terms of the one, it's very expensive. So if you look at the rising cost of healthcare, the average visit, the cost of an X-ray. I did a lot of a study in Korea back in 2004, and an X-ray back then, you only had to pay like $100, $200, but back then a cost of an X-ray would be like several $100. So also the outcomes really don't justify why we have to pay so much. So it's like you get a simple test, and all of a sudden you're charged thousands of dollars for it. The other thing is just in terms of the revenue model, because doctors are compensated by volume. So you see more patients or you do more procedures, you get compensated more. That's changing with outcome-based models, but traditionally that's been the thing: is you see more patients, you do more procedures, you get paid more. With the advent of managed care, when they came in back in 2000, I actually started to see really I started to see healthcare 20 years later, when managed care came in 2000, and I saw that right now you're seeing a high rate of physician turnover, a high rate of physician burnout, high rate of physician dissatisfaction, high rates of physician suicide. I could go on, but we were seeing the effects of our broken healthcare system that we see today. We see a lot of red tape, a lot of bureaucracy, a lot of rules, regulations, really harder and harder for physicians to do their jobs. We have to also worry about getting sued, for doing our, simple basic jobs. Okay. The other thing is the way the hierarchy is structured is that doctors and providers are at the bottom of the totem pole. So what that means is the bureaucrats, the administrators, the executives, they tell the doctors what to do, with the threat of either termination, litigation, so on and so forth. So the insurance and the executives and the state medical and licensing boards are very powerful. So they have a lot of say over the future of a physician. On top of that, you also have physicians that are in huge amounts of debt, 500,000, 600,000. Sometimes, I saw one article where a physician was 700,000 in debt, with 2 kids and a wife, and he wanted to buy another house. That's the sort of status that we see today. Physicians don't have a say in any of the day-to-day business decisions, and so they're completely expendable. So, and I'm happy to I know you have some further questions regarding,
Yeah.
healthcare.
No, I think you said in a very right way. I think physicians are at the bottom, and I think, and that's why we need people like you who can actually lead us, and actually more like many organizations, many healthcare system, like Cleveland Clinic, for example, when physician is the CEO, those systems are run better, and many times physicians have somewhat of a better job satisfaction. But I agree with you. I think some kind of outcome-based model is the way to go, because right now physicians are just running like a rat. I mean, they're just on a treadmill trying to see more and more patients, and they themselves are getting burned out. Patients are not getting a healthy lifestyle type approach. They're just getting more pills and more procedures. I think that we need to change. So I think that brings my question, which is I always ask that in terms of the healthy lifestyle, What do you think will be the impact of having a healthy lifestyle, avoiding any overweight or obesity on our healthcare system, healthcare costs, and how more physicians can prescribe healthy lifestyle instead of just pills and procedures?
So I think our healthcare system is based. The model is rewarded for you're rewarded if you for sick care. So you're rewarded for admitting patients into the intensive care unit, for prescribing medications, doing procedures. So that's how the system is based and rigged. I would say rigged in the United States. You know, medical device companies, pharmaceutical companies, they all want physicians to use their products and their medications. So that's how it is. And the more you can prescribe, the more, you know, the system can continue. So that's that. The in a lot of other countries, it's not that way. So I've studied a lot of countries that, you know, you don't have to spend so much on healthcare. The quality of life is so much better, and people are so much healthier. So I think we need to shift from a model of sick care to a model of preventative care. So that is, you know, avoiding costly visits, adopting a healthy lifestyle, not just diets, but just also in terms of lifestyle, particularly in terms of stress. So I think, you know, stress is the number one. It's a silent killer in the States today. You know, the levels of cortisol, you know, have so much adverse effects on the body, which leads to psychiatric issues such as anxiety, depression, mental illness, and so on and so forth. So if we can shift from focusing on sick care to preventative care, that'll be much more beneficial. So I think, you know, a lot of times I tell my clients and patients that, you know, you can prevent a lot of these things just by, you know, eating healthy, eating right, making you know, wise choices, exercising. And it really doesn't have to be it doesn't have to be, you know, extreme. It's not where you have to go completely vegan or, you know, cut out meats and things like that. It's just do everything in moderation. And if you do everything in moderation, you know, you avoid a stressful lifestyle, you know, we can all enjoy high quality lifestyles.
Well, that's an excellent point. I think stress plays such an important role, and stress permeates into all other pillars of healthy lifestyle. A stressful person is not going to exercise, is going to eat, you know, unhealthy food, is not going to be able to sleep. So I think stress is a number. I think if you want to start with anything, start with stress management, and other things will improve. And I agree with you. I think preventative care is the way to go. And I think many times I always wonder why the primary care physicians and pediatricians actually get paid the least and all the specialists gets paid the most. I think specialists, like you said, typically are meant to take care of the sick people and they get paid most, or primary care are meant to keep the people healthy and they get paid less. We need to reverse that model and see if primary care and pediatricians can spend more time and can actually keep people healthy so they don't need the specialist. I think I agree with you. You know, that brings up a next important question, which has been asked by many of the physicians, even many people, that in terms of Canada versus USA, Canada obviously has a single payer, UK has a single payer. What is your opinion on, you know, a single payer type system in America? Is it something worth looking into? Or I think we are too much of a free of a society that everybody wants their own insurance, everybody wants their own you know, system. And what is your opinion on single payer system for America?
Like again, a complicated issue. So I think you know, if we all went to a single payer system, again, a single payer system isn't really the end all be all. So for example, I did a consulting project with the Vancouver healthcare system last year. So they have a single payer system, but also it's sometimes if you feel like you need extra specialist or you need extra procedure or test, you can go outside of that single payer system with a private insurance. So they do have that sort of model. And again, there's not going to be like one best answer to this, because it's the, you know, you're dealing with economics and, you know, you're dealing with the free markets and different political interests. So, you know, that's why healthcare is such a complicated issue. One thing is that with a single payer system, I've seen it it's a lot slower. So if you need like a really, if a diagnostic test is really needed, the time to get that is a lot slower, as well as a treatment. So that's one of the disadvantages. So the good thing about I've seen with the United States is that it's the most technologically advanced. We have the most sophisticated treatments, the most sophisticated equipment, and that's why a lot of it's expensive. We just don't know how to convert all of that into good outcomes. So um, and again, if it's a public system, it's going to rest on the taxpayers' shoulders. So that's how you're going to generate revenues, through the taxpayers. So in the United States, you have you have Obamacare, you have Medicare, Medicaid. Those are sort of like the public, and then you have the private insurance. So, and again, a lot of doctors are going away from Obamacare and Medicare, Medicaid. I'm just speaking in general, but because that just isn't, they're not going to get compensated enough, so that they just start to turn patients away. So then you have a issue where there's socioeconomic inequality to health access to healthcare, and then you have the competing force where you have private healthcare, where it's so expensive that people can't afford it, and so then you have the upper class being only able to afford adequate healthcare. So again, there's not one good system, and that's why it's even like 20 years later, healthcare is such a mess as well. Ultimately, it's with a public single payer system, it's going to rest on the taxpayers, which essentially means the middle class, because the rich have a lot of loopholes that they don't have to pay their taxes, and then of course the lower socioeconomic groups, they qualify for the other programs. So there's no one good answer, but there's if I had the answer to that, I could probably run for president. But
that's a good point. It's a very complicated system, and I think we sometimes just take it black and white, that single payer versus free market. But I think it's going to require probably some hybrid approach, and I think. Yeah, I agree with you. I think let's dive into your specialty, which I really want to hear a lot of your views on. That number one question is that many physicians, even they're working hard, they're working long hours, they're very talented, they have great degree, they have great skills, but many physicians, even after 10 years, 20 years of practice, they don't have any significant asset built. They don't have any significant saving. They don't even have paid up the mortgage on their house. They don't even have any significant retirement account. So how a physician, learning from your own experience, and now you are coaching and teaching physicians, how can you advise a person like me and many of our 500 physician followers, what is your top 5 advice in terms of what every physician should do?
Again, I'm glad you asked that question. And again, it's not a very straightforward answer. I've, since 2002, when I formally incorporated, when I read the book Rich Dad Poor Dad, and I just started studying economics and trends and history and the markets and finances and business. Because I'll share you with the story, because I thought when I was I subscribed to the paradigm of go to school, get good grades, become a doctor, and then you're set. So when I matriculated in 2000, I thought, all I have to do is complete medical school, finish residency, I'd be set. All I had to do is just get a job. And then 9/11 happened, and I started to see, where the healthcare was going. So I started to really prepare myself for an exit plan. And I've coached a lot of physicians. I've talked to a lot of physicians, and it's really alarming the role of how little financial education physicians have. So, we all go into medicine because, partly is because it pays well. We want to have that nice lifestyle. We want to have that job stability and job security. So we have that, we go into the high incomes, but the problem is we don't know what to do with those high incomes. So, because that's such a high earned income, that's the highest tax. So that's one of the reasons why, for example, the Fed can drop interest rates to almost zero and print trillions at the click of a button. So it doesn't really make sense to be working 120 plus hours, per, for a paycheck, because the Fed can just print that amount in a matter of seconds. So what we have to do is we have to learn how to become investors. We have to learn how to learn how money really works. What is really because the most wealthiest I studied the most wealthiest people, and none of them were physicians. They were all business owners, entrepreneurs, and investors in finance. So those were the people that were the most wealthy. That generated 30 million a year. As physicians, if you make 1, 2 million, 3 million, that's good. But majority, make 500, in the six figures. So that's one thing. The other thing is expenses. So we live lavish lifestyles. We drive fancy cars. We buy these. We have these homes with expensive mortgages, and then we undergo costly divorces. So we really don't really know how to properly manage our expenses, and so that spirals out of control. And on top of that, you have student loan debt. Where you have a 500,000 student loan ticket, even before you become an attending, you're already years behind. Someone that knows how to invest that money, and who knows how to use debt appropriately. So that's the other thing. The other thing is the difference between assets and liabilities. So we all think our house is an asset, but really our house is a liability, because if you see right now, a lot of physicians, their salaries are cut, their incomes are cut, a lot of them are let go. And so how are they going to service that debt? So that becomes a liability. So that's one of the issues. So one thing is I advocate for physicians is one is education. If you have that you take that first step and you start educating yourself, get your head out of the standard medical textbooks, and you start reading finance books, business books, books by people that are outside of your field that are extremely wealthy and successful. For example, Richard Branson or Steve Jobs, Warren Buffett. Then you can get into their minds and start to see how they think. So what it is really they're thinking smarter. They're using their time and their assets and their education in a more innovative and smarter way. Whereas we as physicians were trained to just listen to the teacher, don't cause trouble, get a job, and so on and so forth. But in today's economy, that's not really going to work, because corporations and bosses can terminate people at any time, and it's not really a matter of performance. Sometimes it's a matter of economics, because simply hospitals and clinics can't afford these expensive physicians anymore. So then the other thing is getting smarter with student loan debt. Like a $700,000 student loan ticket is not a wise financial decision. So you really have to start thinking more wisely. Think in terms of what is the cost of education versus what is the outcome. Avoiding costly divorces. Again, a lot of divorces can be prevented. The correct choice of spouse. In these days and age, it may be even wiser not to get married. So these are just ideas. Okay. Avoiding expensive mortgages, not living, or if you do choose to buy a house, choose, something that's, more economical, because in this day and age, the average lifespan of a physician's career, they're going to change clinics and practices, several times. And then just start learning and educating, in business, finance, marketing, and, really start thinking outside of the box.
No, I think those are excellent points. I think some of the books, like you recommended, I remember one or two books actually by the same author. One is The Millionaire Mind and The Millionaire Next Door. And he clearly says that people who actually are, small business owners and people who live in a medium-sized house in a subdivision, there are all large houses, and people who save 10, 20% and invest into either their own business or invest into a proper, stock. I mean, those are the people who are willing to take risks, people who are willing to go and work hard in not just in their field, but dive into other fields and learn every day. I think I agree with you. I think physicians in general, either they are too busy taking care of their patients, or sometimes they just don't think it's important. I think physicians somehow, whatever the reason, think that making money is actually a crime. I think many physicians assume that we run in medicine just to take care of people and that noble cause. But at the same time, the same physician, when he or she gets fired from the hospital, don't realize and don't know how to survive. So I think physicians need to wear equal hat of being a financial planner as much a healer too. I think they need to take care of themselves. So I think that brings to a question. Many physicians are now actually going into this concierge type practice. I think there's a thing called direct primary care model. There are a lot of primary care physicians are going into like a cash only, where patients are charged cash and patient can go in return and build their own insurance. They give them the statement. So what do you think that kind of model? You think that model is a first step for a physician to become a small business owner and take like a cash?
Mhm. Yeah, I actually think it's a great way for physicians to take back control. So I think especially with just like very routine simple visits or very simple things, I think it's a great way for one to cut out the insurance companies, because there's just one is the insurance companies are really just milking the system. Again, there's a role for insurance, but I feel that they're pushing over and they're screwing over the doctors and the providers for their own benefit. So that's one thing. The other thing is I think it'll teach a lot of physicians how to become entrepreneurs and business owners. And for example, I've a lot of my clients are dentists. I find that dentists are extremely entrepreneurial because one of the reasons my thinking is that dentists are very entrepreneurial is because they you don't see a dentist working in a hospital. So a physician, traditionally they'll finish their training and then get hired by a hospital or clinic. But a dentist has to go out and start his own practice, has to recruit patients, has to build a brand for himself. So in that sense, they already have that business built skill set. So, I see a lot of physicians starting this DPC model, which I think is great. The other thing, you just cut out the middleman. And hopefully eventually when I was applying for medical school, I shadowed and I worked for a doctor's office, and this was he was so sick of dealing with insurance companies that he said he would bill his patients for the amount for the services rendered, and they could go and build the insurance themselves, because he was just so sick of all of the red tape. So I think that's one way of physicians to start to gain control back, to cut out the insurance, and also to educate themselves and become better entrepreneurs.
Yeah, I think I agree. I think this direct primary care model, I really like it actually. I think primary care physician, like I said, they're at the bottom. I mean, they just can't afford to keep giving cut and commission to all this, other organizations. I think they need to keep money for themselves. And I think I'm bringing actually a author of a direct care model in 2 weeks to our page. And he's going to explain us how a physician, particularly a primary care physician and a pediatrician, can start a direct primary care model. But I agree with you that your example of dentists being much more entrepreneurial and much more, self-starter and much more better marketer, in terms of just a small business owner. And we all can learn from a dentist as a physician. How can we protect ourselves and how we can take care of ourselves? And to be honest with you, many dentists have much better working hours and their income is much higher than primary care physicians. Mm-hmm. And the liability is also much lower. So I think we are losing out on many ends, and we definitely can learn from dentists. That's a great suggestion. I agree with you. So let's start with some of the things I want to learn from you, which applies to all our viewers, not just the doctors. And that's about our current economic system or economic situation in America. With COVID-19, obviously, a lot of the businesses are closing or closed. A lot of the large department stores are closing, airlines, cruises, everything is pretty much in a kind of recession mode. So please tell us, what is your view as a financial expert and as a physician? What is your view in terms of US economy? Are we in recession now? Even the stock market is not, but as a people, as the people's job, are we into recession or are we out of that?
Well, I think this because of COVID-19, I think we are in a recession. Most like also, I think we're in a depression. I just think that it's being masked by the media. That being said, I also think that the bailout, the COVID-19 relief package just passed, for small businesses and for Main Street. That package was more than 2008 and 9/11 combined. So I think it's all being propped up. I think it's all being propped up by debt. So eventually the debt has to be repaid. So the U.S. is essentially, what we're doing is we're just basically dropping interest rates, printing a lot of money to solve the problem, but we're not really addressing the underlying issues. So we also owe China a lot of money. Again, the market, I think, is being propped up for a couple of reasons. One is all of the free money. So it went to all these probably to Wall Streets and also to all these businesses. So they're pumping a lot into the stock market. So that's what's keeping it up. I also think with the elections this year, so they want to keep Main Street and everybody happy. So so going into the election years, they want to have a good outcome. Yeah, well, I don't know what's going to happen after the election, but that's just been traditionally, in election year, usually they want to keep the economy in a good state. I think the two dominant countries right now in the world are U.S. and China, and I think U.S. is doing a lot to try and gain a strategic advantage, to maintain its dominance. But again, if you see like I've read a couple of books talking about the fall of empires. So if you talk about like Rome, if you see like England, all of them follow the same path that we're following. The United States is on right now. So, and again, this is a very complicated issue. So you have competing interests, you have the free market, you have economics. So there's no one good answer. But again, I see the United States becoming just really highly bureaucratic and a lot of red tape and a lot of rules and regulations. The one thing that United States has going for it is it's the country that has the greatest amount of opportunity. So anybody can come to this country. It's a free country. As long as you don't break the law, and you can pursue. You have all of the opportunity, resources here to succeed. So that's the one thing. There's a lot of disadvantages to the United States, and there's a lot of things that make the United States less competitive. So the United States is losing out to countries in terms of education, to Asia, to China, to Europe. So, but the thing is, we have so much opportunity, and really, the United States is founded upon entrepreneurship. So we have the best ideas, we have the best technology. It's just that there's a lot of things that hinder and stifle us. But I hope that's a long-winded answer.
No. I think you said in a very right way that we have some great characteristic to overcome what Roman people and UK people went through. But I think it will require hard work, and it will require some discipline. It will require some new ideas and new thinking. And our politicians, I think, need to start listening to people like you. I think otherwise, if they're going to keep doing this old way of doing it, I think we're going to go just like what Romans were. And I think bureaucracy is getting bigger. Elections are getting more and more expensive. So there is a lot of lobbying, and there is a lot of special interest, going behind every elected official. And they are not listening to people's need. They are listening to essentially whoever supported them during the election. I mean, presidential elections are in $1 billion election. I mean, that just speaks that how does $1 billion come? Now, fortunately, some of the newer candidates are asking every small person to contribute, and hopefully they're going to, but those are minority. The majority of the candidates, their funding come from large corporations. So I think that itself, it concerns me in the long term. So that brings another side question now, that knowing you active on different platforms and social media and other things, including Twitter and other things, please tell us, even for myself, for learning from you, that how a physician, or for that sake, any of our follower can get better with social media, and how can they master social media?
Well, I social media. If you think about it, really, one thing you can start do is just number one thing you do is just start an account. So that's one thing. So determine what kind of type of media that resonates with you. So if you're into pictures, that could be Instagram. You know, and again, Instagram has like videos as well. If you're into long form content, YouTube. If you're into news and tweets and words, then Twitter is good. And so one thing is just what type of media format resonates with you, and just go on to those platforms. Just start a channel. And I like to view the social media channels as media outlets. So now instead of NBC, Fox, CBS, now we have Dr. Shah, we have Dr. Liu. Everybody is their own media outlet. So the way to find success on social media is to actively and consistently post, your thoughts and your views in a very creative and in a very informative, and also a very with your own twist and your slant on things. So that's one thing, is just stick to a schedule and just find which media channels and outlets that you resonate with, and then start to post your thoughts and your views. So the other thing is to distinguish social media between personal use. So that's, for example, posting photos of your trips or your food or things like that, into more of a business media marketing sense. So that's more to gain followers, more to communicate with your audience. That's more to deliver content, like free content. So start to think of your channel in terms of that way of connecting with your audience and your viewers, building your personal brand. And that way, and from there, you will attract the following. And it's just, if you do it over, a period of time, you will have attracted that following, and then all of a sudden you become a success, as they say.
Yeah, those are excellent points. And I think I definitely have learned that for me, I think Facebook works. I'm better able to reflect what I'm thinking, what my views are. Plus, we also have learned that there are certain things on Facebook doesn't work either. So we are on other platforms also, like Instagram, for our recipes and other things. But one thing I learned also, that if you want to attract the whole population, not just a small segment, you need to be very diverse. And I think sometimes I get advice that I should be very focused, but I'm realizing that both has its own pros and cons. When we started with 6 pillars of healthy lifestyle, they were only the health pillars. But then we realized that a 30-year-old person who is relatively healthy has no interest in my page, because that person either is a parent or is a student or has a financial knowledge which he or she needs to gain. So we expanded our pillars into 20 pillars. And now we have not just our followers, but you, including our guests like yourself. We bring all different guests, not just doctors. We bring a Iraqi vet who actually explains about how a military life is. We bring even a mom who has gone through unfortunate loss of the son. I mean, we bring all variety of people. We are big on women empowerment. So I think I agree with you. You have to find the type of social media you are comfortable with, which resonates with you. And then you have to keep tweaking to see what works. I think Facebook is just giving you a blank slate. I think we need to write on that blank slate what works for us. And that's a different than like traditional TV media, where they pretty much manage everything when you bring them. So I think I agree with you. I think that's an excellent point. So that brings up a next question. I've seen you in action. I've seen actually a lot of your podcasts and other things, that you are very good at coaching, not just physicians, but a lot of entrepreneur people, a lot of business people. So please tell us, what are the good qualities of any coach? Like if I want to be a better coach, what certain things I must have as a coach?
Besides experience and wisdom and just knowing when you can take a client and you can see 10 years into the future for them. So that's besides the experience, but you also have to be able to relate to the client. So you have to be able to relate to them from where they are in their journey. So you could be up here in your journey as a coach, but in order to work with different subsets and different segments of clients, so you have to be able to reach them where they are. So you have to go into their mindset. So for those that are just first starting out, their mindset is probably going to be based on a lot of fear and a lot of scarcity, and based on a lot of what do others think about me? What do others say about me? Whereas if you have someone further along in the journey who's already taken that leap of faith and started their own company, they're probably thinking more of, well, what can I do to maximize my day to day? What opportunities can I pursue? How can I best maximize my time? And how can I best, create the best product service? How can I market to that segment? How can I reach that customer? So you have to be able to go into there and reach them in a very effective and empathic manner, and speak to them from there. From there, once you get into their head and you're able to form that rapport and trust with them at that level, then the real work begins. That's where you begin to able to dissect their mindsets, their beliefs, what is holding them back, what are they fearing, what do they want, what do they need, and what do they wish. So you have to be able to speak to each of those different categories, and from there you offer a strategy and a plan of action so that they can get to the next level. Once they get to a certain point, you have to be able to make sure that they don't revert back. So you have to really solidify all the concepts and all of the tools, tactics, and strategies, that all the work that we did, the month prior, 2 months prior, so that they don't revert back to where they started. So that's where coaching is. So, coaching is an art and a science to it. And, I've if you see the best sports coaches or best business coaches, all of them have their own different ways of achieving their results. So.
No, I think those are excellent points. And when I took my lifestyle medicine boards, we all realized that we don't get proper training in medical school how to be a good coach. We get great training in writing pills and doing procedures, but I think we don't get a course on coaching. I hope it's changing now. But when I took my lifestyle boards, we had almost 10 to 15% of our training and our exam questions were on coaching. We had like almost 8 hours of coaching lectures and coaching training. And I think to be honest with you, most physicians make very lousy coach. When it comes down to changing people's behavior in terms of healthy eating or exercise, many physicians cannot change the behavior. They can prescribe a Lipitor, but changing a behavior. And that's where I think we need people like you who actually can coach, not just for their own well-being and their own financial health, but also to become a better coach physician, coach for the patients. So I think coaching is a like you said, it's an art and science itself. It requires some learning. It requires some reading books. It requires mimicking some of the great coaches. I think all those things we have to constantly do it. But coaching, in my opinion, is as important as the medical knowledge. So I think we all have to be a good coach. So let's go to the next question. You have an upcoming TED Talk coming up. Please tell us about your TED Talks and what is the topic and how people can watch it.
Mm-hmm. So it's coming up in October 2020. It was supposed to actually be in April, but because of the COVID, it got delayed. So basically what it's talking about is we as baby boomers, Gen X, millennials, and Gen Z, we're going to, in the next, by 2030, we're going to be inundated with the onslaught of automation, artificial intelligence, artificial mixed virtual reality, blockchain, autonomous vehicles. So what that means is essentially our entire way of thinking and our way of lives that we've enjoyed over the last 50 to 60 years plus is going to significantly shift. So those who embrace that shift, those who embrace that change, those who get ready for that change are going to flourish. Those who are who stick to this status quo or don't want to embrace these new ideas and beliefs are going to struggle. So you see that today, but it's going to get even worse in the future. So it's really about embracing change. It's also about educating yourself. So when I talked about earlier, reading books and articles and things outside of your field, and preparing yourself. Start seeing what the successful people are doing outside of your field and start modeling them and start using what they're doing into your own personal and professional life. And it's really about embracing your fears. So, you know, if I hadn't transitioned from just a traditional medical career into becoming an entrepreneur, you know, I'd still be stuck and I'd be miserable. I'd just be, a cog in the wheel. But now I'm, impacting lives. So really need to face your fears. The other thing it's going to talk about is the top skill sets not taught in school that we need today to survive and thrive. So school just teaches us reading, arithmetic, and writing. So that's it. But, if you think about it, that's just 3 skill sets. But in the real world, there's, 8 or 9, there's actually 8 different core competencies, different types of intelligences, but school only emphasizes 3. So what we need to do to survive and thrive are, 1, we need to learn how to work together, how to network. We need to learn how to really position ourselves and market ourselves, our products and our ideas. So it's going to be about, taking your intellectual ideas and your property and how to communicate that through public speaking, through marketing and sales, and things such as that nature. So.
Wow, a fascinating talk. I think we need more of those talks, and I think I'm glad you are doing it because you bring a perspective as an orthopedic surgeon, perspective as a PhD in nano physics, nanotechnology, and also being a financial expert. So I think we need. I hope this lecture is viewed by many people of my age as a wake-up call because in 2030 I will be only about 68 years old. I still have 20, 30 years of productive life left. So if I don't embrace the change, if I don't learn from my kids and my grandkids, I will be just sitting on the sideline. And I think I will hate it. And because right now I'm enjoying the way everything is going, but I need to keep up. And that's what I think, enjoying the technology. I think fortunately, whatever the reason, this COVID-19 has brought some technology in people's life. People who never ordered from Amazon before, now they have Amazon app on their phone. They are on Zoom call with their grandkids. So there's always a push to change and push to learn. And I hope people learn without this kind of crisis. And I think I agree with you. I think every day we have to learn something which is beyond and outside our own field. I read every day, which is not medicine. I always tell my family members, always tell my friends that always learn something which is outside your field. Otherwise, you will be just so like a frog in the well that only thing you know is the small water, thinking that's all the world is about. You need to go out and experience the whole ocean. You cannot just be a frog in a small well and just think that that's all I'm going to have. I think then you will not be able to overcome the crisis. So that brings my next question. You've been an author. Please tell us about your books and how can people buy it?
So they're all on Amazon. If you go to Amazon and type in Christopher H. Liu, MD, PhD, I've written 4 books. And my impotence for writing the 4 books were because I had so many inquiries. And I really didn't have time to answer all of the inquiries. So those books are there as resources so people can go and read about it and learn. So those are sort of just basic extensions of myself. And I wrote them around the 4 passive income streams that allowed me to gain financial freedom. So the first book, that's my keystone book. That's my autobiography. That was my book that I wanted to share the world. And that's essentially, me as growing up, Asian American, being the outsider, growing up in, dysfunction, bully, discrimination, and how why I chose medical medicine. And then from there, how I pivoted, how I pivoted out of, this sort of dysfunctional system. So that was one. And then I leveraged that into writing 3 additional books. So the first book was talking about stocks and options. So stocks and options are how I initially gained my financial freedom. That's how I was able to generate cash flow without needing to work for a job or work for a boss. So that's how I was able to generate that. I leveraged that into the next book where I talked about starting my consulting company and how I was able to. Last year, I broke 7 figures. So it talks about how to grow and scale your consulting company, how to build your brand, how to network, and how to do that in today's digital age, as opposed to traditional forms of growing and scaling your company. And then the last book I wrote was more for just to share how I wrote my 4 books and go through the process. What I've since done is from those books I've created digital products and programs. So I run online masterminds, monthly masterminds. So we have one tomorrow, and a lot of online products and courses. So that's where we really get into like the real time issues, real time ideas. For example, like LinkedIn networking, how to market real estate on Airbnb, how to become a public speaker, how to get your TEDx idea accepted, and so on and so forth. So you can check them out. You can always reach me as well. I'm on social media.
No, I think that's such an important information you gave us. I'm getting all your 4 books today. Actually, I'm reading them and then I'm giving it to our kids. And definitely, I think we can learn so much from you. And you also have now other media, other way of learning from you. So I think we are all very, very thankful to you that you provide this kind of coaching and this kind of training. And I think I'm also a budding dreamer of giving a TED Talk. So I think we all can learn from you. We all can mimic you and kind of model from your own life. And I think you definitely are a shining example of an immigrant son. I think our son himself went to Harvard, so he did a Harvard law. So I think I really admire people like you, like him, our daughter who is in medical school. I think it requires a lot of hard work, a lot of planning, a lot of passion, a lot of intelligence, and a lot of sacrifice. And I think I really admire you to getting to this level at such a young age. I think I look forward to see your journey, where it takes you, every year after year. So I'm going to be a big fan of you. I'm going to follow you. I'm getting your books today. So I really, really appreciate you coming on. Our followers and all the doctors on this page are going to definitely like our talk today. It will be on YouTube in a few hours. So I think people are welcome to watch it, share it. So that's great, Chris. I'm going to go off live unless you want to add something.
Just follow your intuition. Really, like against all odds, sometimes my intuition told me things that I thought were just outright crazy, but I followed them. And if you follow your intuition, it's always brought me out on the top position. So listen to your intuition, listen to your gut, and just go for it.
My intuition was to bring you on our page, and I'm 100% right about it. So that's a great feeling. I'm going to go off live. We'll talk for a few minutes, Chris, so just hang in there.